Hello and welcome to CE Institute. My name is Selena Belisle. I am the founder and one of the instructors here who teaches geriatric massage and body work. In this video, I'm going to discuss nursing home, palliative, and hospice care, plus give you some information about elder abuse for licensed massage therapists. This video is used in part of our larger training for advanced massage and bodywork for geriatrics and seniors. Whenever we can share information from our training on this YouTube station, we do so that everybody can benefit from it and so that old students can come back and see this again and review it as a refresher. However, if I mention during this video things like you can download student files or something like that, that is with the paid training. So if you'd like to learn about this subject and more for advanced senior massage and bodywork for geriatrics, you can purchase this training from us at our website, ceinstitute.com. And we hope that you enjoy this free video presentation right now. One of the first things that I want to review with you, if you've never worked in a medical facility before, is coding that medical facilities use. This is the badge that I had when I worked at the Miami Cancer Institute as a volunteer. And you'll usually have a badge or a name tag, so you're going to need to bring government issued ID, usually to a nursing home or hospice facility. They're probably not going to let you in without. There's usually a sign-in process and stuff like that. You might get a badge if you're working for the facility, and if you're just a visitor, if you were a hired professional to go in and work on an elderly patient, they'll probably give you some type of name tag. When you're at the facility, regardless if you're an employee or volunteer or not, I want to show you, these are hospital-based codes. I'm going to give you a better definition of this on the next page, and then I'm going to, this is also in your workbooks as well. So when I volunteered at the Miami Cancer Institute, I had my badge, and then the second part of my badge, which you kept clipped on your uniform or clothing at all times, were these codes on how you can create a safe workspace for yourself and your client. Here's a list of medical facility codes that you can look up on the internet. We've included these in the student file downloads that's included with our paid home study course. And these code colors are pretty common for industry standards. Code blue is when someone's in medical distress, such as cardiac arrest. I called a code blue once when my client was not breathing. They had an adverse reaction to medication, anaphylaxis, they had swelling, it closed their trachea and their ability to breathe. And I called the code blue, and I was almost rewarded for it because it literally saved the client's life. So if you're going to work in a nursing home or geriatric hospice care or palliative care, it's important to learn what these codes are if they use them, because it's a way to get urgent help for your client and yourself. There's something such as a code black that usually allows for a police response if you find that there's something that's threatening to you, your work, or your workplace, or your client. Learning what these codes are will help you be able to better communicate emergencies within the workplace. Now, if you're working in a medical facility that is using coding, they should also instruct you on how to call a code. Most medical facilities will simply have you reach out to the nearest landline and dial for the operator and just call the code. The operator answers and you say code blue, room 442, or wherever you are. And that allows the operator to very quickly alert medical personnel to respond to that code. Usually you'll hear them over an intercom system. So as you hear codes being called throughout the day, if you know what the codes are, you can better understand them, especially if there's a bomb threat or fire in the facility. You might be able to make yourself more useful knowing what those codes are, both protecting yourself and your client as well. Now, sometimes when you're calling those codes, you're going to need more information, and the operator will ask you for that, and you should stay on the line until the operator dismisses you or lets you go. If you're the only care provider in the room where your client is experiencing the code and you've called it, you might say, can I start administering CPR right now? And just get back to the patient. The operator will usually give you directions of what you should do next. Now, sometimes, regardless if your geriatric client is in a nursing, palliative, or hospice situation, they could have ended up there quite quickly because they experienced something like a stroke, and now they're permanently disabled, and they might not even have much time left after the stroke. Hopefully there's something like a living will that was established prior to entering one of these care facilities. A living will is an advanced care directive for that particular client. They fill out, usually it's a questionnaire that says what their health directives should be if they become incapacitated and they can no longer vocalize what they wish to be provided for their care. Knowing what the living will is and what those directives are might be appropriate for you with your massage service. If you have a regular geriatric client and they've added in their living will, I want a once a week appointment with my massage therapist, and now they're in a nursing facility, you can reference that living will when you're trying to make an appointment and get access to the facility, that this is part of the patient's living will to continue this care. Sometimes your clients will have a health care proxy. They might have a proxy with or without a living will. Now, if a person becomes incapacitated and they didn't have a living will, but they do have a healthcare proxy, the proxy appoints someone to make medical decisions on the client's behalf. It's usually a relative, or it could be a friend or an attorney or spouse. And if you're regularly working with a geriatric client and they can no longer vocalize their wishes, you can try and reach out to whoever has a healthcare proxy and ask them if you can continue your massage or bodywork sessions with wherever that client is. Now, if the client does have a living will and a healthcare proxy, it's a good idea to reach out to the healthcare proxy if you're part of that living will. The client still wants their weekly sessions even when they become incapacitated. And just make sure you're working with the healthcare proxy to say, hey, this is in the living will. I just want your approval that it's okay to keep these sessions going. If you do not notify the healthcare proxy and you don't contact them, that can create some friction and issues because the healthcare proxy generally wants to know what's going on. They're usually, hopefully, coordinating the geriatric client's healthcare, and they might have some medical changes that they need to make you aware about, such as they're going in for surgery tomorrow, so you don't show up for an appointment while your client's no longer available. Now, one of the reasons why you would want to know if there's a living will or reach out to a healthcare proxy if there is one is to learn if there's a DNR in place, especially in hospice care where the patient is usually terminal. Now, a DNR is a do not resuscitate order. It's maybe directed in a living will. In a living will, it might say how many days you're allowed to have advanced life-saving measures, such as being on advanced life support before they pull the plug. And the healthcare proxy might make that decision for the client if there is no living will directive about such a situation of cardiac arrest. Now, if you're in a medical facility or even caring for the client in their private home, you want to know if there's a DNR in place, because you definitely do not want to be providing CPR to a geriatric client who does not want to be resuscitated. Most of us do not want to live like vegetables hooked up for a machine for a long period of time. And if you do resuscitate somebody who's been in cardiac arrest for several minutes, they could have no brain activity, and that could be a possible and detrimental way for that client if they did not want to live that way. So if you are in a medical facility that uses codes and your client experiences cardiac arrest, you must call the code blue even if you know that a DNR is in place. And once that emergency medical responds, and you can even tell the operator, I believe there's a DNR on this client. You can share that information with the medical personnel, but make sure you've seen that in writing and verified it before you share that information, because you don't want to be on the hook for something that is so vital to a person's life. And hopefully the medical personnel know if the client is DNR already. DNR is something that I don't usually discuss with a client. I don't think I've ever discussed it with a client, but when I'm working with a terminal client or they're very old, elderly, frail, I usually do try and find out if a DNR is in place so that I'm not trying to resuscitate a geriatric client without their consent. Also, if you are going to perform CPR on a geriatric client, especially if they have osteoporosis, it's very likely that you could break a rib, crack the sternum, and cause bone fractures while performing CPR. So these are all considerations to be made when working on elderly. Now I'm going to provide some definitions for nursing, palliative, and hospice care, although the definitions can vary depending on who you're speaking to and the facility itself. A nursing home is a residential facility, usually for elderly people, senior citizens, or those who are disabled. It's not always elderly geriatrics in nursing homes. I know of someone who had a double knee replacement, both knees done at the same time, which they do not advise any longer. And he was sent to a nursing home because the recovery centers were all full. And the nursing home was able to provide skilled care so that he could recuperate before going home. So in a nursing home where it's for a geriatric or a senior citizen, usually they require residential care in a residential setting, but they don't necessarily need to be in a hospital. They don't have any acute illness requiring hospital care. So nursing homes provide things like your meals. They might administer medication for you. They provide hygiene matters, such as making sure you're bathing, and they might bathe you. They provide entertainment to improve your quality of life and more. Nursing homes are also referred to skilled nursing facilities or long-term care facilities as well. Palliative care would be somewhere between the nursing home and hospice care. Palliative care is for people who have life-threatening or life-limiting illness, and the medical care requires more than what you can receive in a nursing home. However, you don't necessarily need to be in a hospital for that care either. Being in a hospital exposes you to more risk of infection. There's usually alarms going off at all hours of the night. It can be stressful staying in a hospital. So palliative care is supposed to be a place where you can receive intensive medical care, even possible curative work, definitely medical care to relieve symptoms and make you more comfortable with your life-threatening or life-limiting illness. Hospice care is usually end-of-life care. Now, let's say that you're going to live more than a few days, but you have a life-threatening illness and curative options are no longer available to you. So you might have been fighting cancer, you're stage 4, the chemotherapy is dropping your red blood cell count to the point of no life. So they've stopped the chemotherapy and you're going to live out your last days as comfortable as possible, you would go to hospice care. There you can have a more comfortable setting. They can treat more aggressively with opioids or what have you to relieve pain. You might receive spiritual guidance and help. It's definitely a place that's created and supports end-of-life circumstances, not just for the patient, but usually for the patient's family as well. So it's a really nice place for a person to be when they're approaching their last days, hours, minutes, and seconds of life. You as a massage therapist could be working in any of these different types of medical scenarios. The choice will be yours. When you work as a licensed massage therapist in a nursing, palliative, or hospice care facility, or even a hospital, your general goal is to improve the client's quality of life. You want to do anything possible within your scope of practice to make them happier. There are a number of ways that you can improve a client's quality of life, especially in end-of-life situations, whether they're at home or in a medical facility, that go above and beyond what we're going to teach you for tactile, hands-on massage skills. Let's review the different ways you can improve a client's quality of life and make them happier as a licensed massage therapist. We call the following work and tips sensory input. It's all about adjusting sensory input for your geriatric client so that they can enjoy their time with you even more. Most of us play music during our massage or body work time, and most of us have apps on our phone which allow us to choose which music we'd like to play. My recommendation is learning what the client likes for music and playing that music for them. That will be a wonderful added benefit to your client if you're now going to go see them in hospice care or a nursing home. They might have had a stroke and they can't vocalize what they want anymore. If you knew them and were providing body work for them prior to their hospitalization or wherever they're now, and you can play what you know they like, that's going to improve their quality of life and care. There are a number of things that you can adjust for your client beyond the pressure of your massage or hands-on body work. That includes adjusting the volume of your music, making sure it's loud enough so that they can hear it, but not so loud that it's annoying. Also, the room temperature you can adjust as well, especially if you're at their house alone and they're immobile to go and adjust it themselves. Usually a couple degrees adjustment is not that big of a deal. If there's a healthcare proxy or a nurse or someone, you can always ask them about adjusting it before doing so at the client's direction. And make sure you're not doing anything that could create a life-threatening situation, such as if it's July and they want to turn the air conditioning off because they're too cold. Well, we don't want them to have heat stroke because they're also, becoming overheated and too hot. And also if it's, of course, winter time and they're really hot and they want to turn the heat off, you want to do that as well. Make sure whatever you're adjusting for the client's sensory input makes sense for life measures. If you're not able to adjust the room temperature and the client's cold, you can always throw on an extra blanket, make sure it's sanitary, and make sure to continually check in with your client, especially when adjusting the temperature, to make sure that it's an appropriate adjustment and continue to adjust until they're happy. If you're going to provide a sweet session or Reiki or some type of body work that does not require the client to get undressed, make sure that they have comfortable clothing and adjust it as needed. Now, sometimes in medical care facilities, your client might be wearing a gown, and some of these gowns have ties and snaps on the back, which can create pressure, especially when it's on a vertebrae or the spine or sensitive areas of the skin. They might have a wound that's infected and bandaged. They don't necessarily want to be lying on that. So make sure when you are providing their body work, they're as comfortable as possible. If they're wearing shoes, take them off. If they've got a belt on that, it just feels tight or something, make sure whatever you're doing that they feel comfortable in whatever's on them while providing your body work. Now, if they're immobile in bed, you want to make sure that you're very careful with any type of implements or tools, whether there's something you use for yourself or it's something that was already there with your client. If they're immobile, they're usually eating in bed. Make sure if you moved forks and knives that they're not still in bed when you leave. Same with the TV remote control. If you use things like crystals during your therapy, make sure you do not ever leave crystals in a client's bed or on top of the client, especially if they're paralyzed and can't move them themselves. I can tell you that when I was in an ICU, when I was younger due to a motorcycle accident, my best friend came in and she left crystals all over me to help heal me. And one of these crystals ended up underneath my back for 2 days and caused like a pressure wound. And I was physically handicapped at the time. I had a drug-induced paralysis to help with the healing. And I wasn't able to vocalize. I had a tracheotomy, so I couldn't speak at the time. They didn't button my trach and I couldn't physically remove it. There was no way to communicate that there was a sharp crystal underneath my shoulder blade. Can you imagine a geriatric client with thinner skin in that type of situation? So make sure that there's nothing in bed with the client. Make sure your massage creams, make a checklist of what you bring to the client and make sure that it's not in their bed where it could cause further injury to them. Also, there's usually a call button in some of these advanced care directive places, and I have a picture of that in the upper left-hand corner here. The call button should be on the railings of their bed. They'll usually have railings to prevent them from falling out. If you put the railing down, make sure to pick the railing back up after your body work is complete and make sure that call button is restored to their bed. Adjusting the lighting in the client's room can also help with sensory input and to improve their enjoyment. Now, sometimes your geriatric client could be sharing a room with another person. You need to make sure when you're making all these adjustments to the room for your client that it's in sync with what the roommate would be okay with as well. If there is a roommate there, you might want to check with the nurse or whoever's in charge of that care facility when there's roommate situations about adjusting the temperature, the sound of the music, the lighting, and so forth to make sure that you're not doing anything wrong that would make a situation worse for the roommate. Whenever you can reasonably adjust the sensory input for your client, I would do so as long as there isn't any type of detrimental side effect. When providing your massage or body work, make sure that you properly adjust your client, such as if they are in supinated position, there should always be a pillow underneath their knees. And hopefully you've given them a pillow underneath their head as well, which would can help with breathing. Sometimes you want to bring them up to a semi-recumbent position when they're supinated face up, which means inclining the back of the client further up, almost like a prenatal client when they're supinated. You want to sit them up a little bit in bed. They don't have to be sat up at a 90-degree angle, but maybe on a 30 or 45-degree angle might make them more comfortable. If you do pronate a client in their bed, hopefully you brought a massage table so you could use a face cradle, because pronating a client in their regular bed with their head turned could cause stress to the cervical area. When they are pronated on the massage table, make sure you're using an ankle bolster to provide proper alignment for the spine. And if you're in advanced care where the client is bedbound, they are not able to get out of bed, make sure that if they were in a particular position and you're changing the position, that it's okay to do so. Sometimes there are pressure wounds and skin ulcers from lying in a certain position for a long period of time. You don't want to put them back in that position to exacerbate their ulcer or wound. So changing the client's positioning is one way to adjust their sensory input to make the outcome more enjoyable. Again, as long as it's not harmful to the client. Now, it's not within my scope of practice to feed or hydrate my clients, okay? That's up to the nutritionist and the care facility. However, your client will not enjoy your session as much if they're hungry or thirsty during it. And many care facilities are often short-staffed. So as long as I have medical permission from the nurses or doctors or whoever's in charge of the client's care, I will ask them if it's okay to get them water or a snack or something, especially if I work with a client on a regular basis and I know where these items are. When I worked at the Miami Cancer Institute, many times my job as a volunteer was to get them liquids and food because the next day they were going to be very sick. So that day we were trying to give them as much nourishment as possible because the next day they weren't going to have any. So I regularly check in with my client and ask them if they want any water or if they're hungry or anything like that prior to the service. Just make sure that it's okay, because I'll give you an example. You might think providing water is okay all the time. It's not. I had one client who was a leukemia patient at home, dying, end of stage life care. They had a daily, I think maybe twice daily nursing visit that administered pain medication and checked in on him. And he only had a couple days left. He did not have a feeding tube or any type of drip of saline. And without water or food, you're going to die within, a couple days. And he probably had a couple hours left. He was pointing to this cup where there was a sponge for water that they would wet his lips. And, he was all dry and dehydrated, like massaging him. His skin was like white and flaky. Like it just, he was so dehydrated without any water. And so I took that sponge and I put it on his lips, and he got a drip of water in his mouth. And I thought he was going to choke to death right then and there. He was coughing and coughing and coughing. So what happens at end of life stages is sometimes you'll be very weak and you won't even have enough strength muscularly to be able to swallow. And I almost probably killed that man. And that was at the very beginning of my career. So don't assume that providing water or giving somebody ice chips or whatever's being done by medical personnel is it okay with you. Even if they left the sponge there, they might have discontinued it and not removed the sponge yet. So be very careful when it's outside of your scope of practice. Just before you do anything, check with the medical personnel to make sure what you're doing is acceptable and directed by them. Adjusting sensory input could also be learning what the client's favorite color is and then applying that wherever you possibly could. Now, if your client loves purple, I might wear a purple top. I might use purple towels. I might use anything purple that I can to hopefully make the client feel special and recognize that you're trying to make them happy. That usually in itself, the effort, whether you pull it off successfully or not, the fact that you made an effort usually makes somebody smile. If you're trained in aromatherapy, you could possibly add some type of essential oil to your geriatric client's treatment to increase sensory input and give them as much added value as possible for their enjoyment. Be very careful when you're working in a medical facility, especially if you atomize something in the air with an ambient bowl or a diffuser. Let's say someone's allergic to that chemical constituent in your essential oil in the facility. That would be detrimental to another client's life and a medical error. So be very careful when you're adding aromas or something that could affect other patients within a care facility. If they're in their own isolated room or at home, then it's usually easier to administer. I would be careful with fresh flowers if your client's on advanced life support. Usually they do not want fresh flowers in a room where there's a breathing machine, because if that pollen gets into the breathing machine, it can be detrimental to it. So make sure when you're bringing something into advanced life care, such as fresh cut flowers or something like that, you get the facility's approval first. You might go into a room and it'll be sterile. There'll be nothing in it. And you'll be like, wow, has no one thought of this person? Did they even know they're here? Why isn't there any flowers or anything? And it just might be the person is highly infectious at the moment, or for other reasons, such as the pollen getting into the life support machine. Now, let's say that you show up to your appointment and it's already paid for, the family paid for it or the client paid for it, but the client's contraindicated for service. You cannot provide hands-on treatment because they might have infectious disease or just something like sepsis, which is a response to a blood infection, and it might not be contagious. But either way, you cannot do circulatory massage or body work for whatever reason. There are other things that you can do for sensory input if the appointment's paid for and there's no way to reimburse it or something like that. Now, in many states, hydrotherapy is included as part of a licensed massage therapist's scope of practice. So if a client does have sepsis or some other form of infection, usually placing a cool cloth on the client's forehead is a really nice way to help the client feel more comfortable. Again, it's all about sensory input to increase or improve the client's quality of life. One of the most important things you can do with your geriatric client is to be happy and positive. You can be walking into some pretty shocking situations. Nursing homes often smell like ammonia. They have a really unpleasant odor to them. And a lot of these care facilities are short-staffed with stressed people working there. So you might be their only sunshine during the day. So adjust their sensory input by being positive and happy. That can be contagious for some. And as a friendly reminder, when you're being positive and happy and adjusting all these sensory inputs, to please check with the medical care team to make sure that whatever you're adjusting is appropriate for the client, that it's not going to create some type of new medical distress for them. And remember to only practice whatever's within your licensed scope of practice. Usually getting somebody a glass of water is okay. Providing a meal is definitely not within your massage therapy scopes of practice. If a doctor directs you to bring a snack to the client, then that's usually covered under the doctor's license, depending on the state that you practice in. You would want to check your own state statutes and laws and rules for your scope of practice. If you are doing it for a loved one and it's familial care, your mother or something, that's usually acceptable as well. But when it's paid care, it's really important to be within your scope of practice. You might just want to tell someone that your client is hungry, and that allows them to be able, the correct trained and caregiver can provide the snack, but you initiated it so they're no longer hungry, and that improves their quality of life. And even if a doctor directs you to give the client their medicine, do not do it, okay? That is something that must be done by the doctor or nurse or whoever's scope of practice it is to administer medicine. Now, in the United States, medical errors is regularly a top cause of death every year, and many of times medical errors are due to inaccurate prescription medication being administered with the wrong dose. So don't take that upon yourself to do their job, even if they're short-staffed and stuff like that. They must administer the medication to the patient. Now, it's really important to make sure that your client took their medicine. That is your business. That's within your scope of practice, to make sure that the client has taken their medication. Because let's say they're suffering from high blood pressure and they haven't taken their high blood pressure medication all month. I had a client who stroked out in like April, and his last time he filled his prescription bottle was in November. He hadn't taken his heart medicine for months and had a stroke because of it. You don't want to be massaging a client that hasn't taken their heart medicine for months. So it's okay to ask your client if they've taken their medication, but if they're unsure or they haven't taken their medication, you need to get the medical personnel involved, the healthcare proxy, whoever's in charge of their medical care, to make sure that they are being provided for so that you can provide good care yourself. I think it's important to try and get other people involved in your client's care, whether it be family or advising medical staff about what your client enjoys, whether it's favorite colors, temperatures, sounds, music, what have you, so that they can also contribute to the client's quality of life. Just be careful that you're not violating any type of HIPAA statute. You shouldn't be sharing the client's medical information, such as if they have a wound or something like that. You really can't tell the client's family about it unless you have written consent to share that medical information with them. It's important to involve others, because if you do see a slight skin wound or something during your massage, your bodywork session, you should immediately notify the medical team. They might be aware of it, they might not, but you could hopefully prevent a more serious infection. You probably will see the client's naked body more so than the medical team if you're actually performing full body massage for the client. So make sure that you communicate and chat with others. That's usually the best possible care you can provide for your client. Now we're going to take a moment to talk about recognizing elder abuse. Elder abuse can happen within the geriatrics care team, at home, or at a medical facility. According to the Alliance for Aging, geriatric abuse can include any of the following: cuts, punctures, wounds, burns, bruises, or welts on your geriatric client. If you see these, and it's especially not a one-time occurrence, you do need to alert appropriate personnel so that they can investigate if geriatric abuse has occurred. It's not up to you to make the determination if it has occurred. It's up to you to report what you've seen to appropriate people. Dehydration or malnutrition, poor coloration, sunken eyes or cheeks are also signs of possible elder abuse. Soiled clothing or bedding, and lack of necessities such as food, water, or utilities would all be considered a form of elder abuse. Behavioral signs of elder abuse could include fear, anxiety, agitation, anger, isolation, withdrawal, depression, non-responsiveness, resignation, ambivalence, contradictory statements, implausible stories, hesitation to talk openly, confusion and disorientation. Now, any of these signs could also be because of cognitive impairment. It could be because they're in a new surrounding. It could be something that is a side effect of a medication that's making these behavioral changes within your client. Again, as licensed massage therapist, it's not our job to diagnose this or create judgment around it. But if you do see these behavioral changes, it would be appropriate to report it to a trained professional without violating the client's HIPAA rights. Neglect, such as employee or familial disregard, is also considered a form of elder abuse, whether the geriatric client is sitting in their own soiling of urine or feces, or the family isn't visiting. You can see the behavior and report the behavior, but you shouldn't judge the behavior, because especially if you don't know what happened in the first 70 years of your geriatric client's life, maybe the grandmother never was involved with their kids or grandkids' life or something, so they only come once a year. That's not neglect if that was their normal pattern. So make sure that you just simply observe what's going on and report it instead of making judgment about it. Now, if the client's in a medical facility, you can always try and speak to the nursing manager or a doctor whose hypocritical oath is to do no harm. And if they're aware of harm occurring, then it is their responsibility to rectify that. If they're at home, you can always, whether they're at home or in a medical facility, you can call the police. Report what you've observed, hopefully without violating HIPAA. You can always contact your own lawyer if you're concerned about HIPAA. And there's also an elder abuse hotline called 1-800-96-ABUSE. If you dial that phone number, you can also anonymously report what you found. Unfortunately, anonymous reports are not taken as seriously. So do whatever you can if you do suspect elder abuse. If you don't say anything, that's almost neglect on the behalf of another caregiver. So it's really important to report what you've seen when you have a suspicion. We do have some research studies that show that massage and bodywork in nursing home facilities and these medical facilities are beneficial to the clients. In this 2009 research study titled Massage and the Management of Agitation in Nursing Home Residents with Cognitive Impairment, they found 5 behaviors were significantly improved with massage. That included the clients wandering, verbally agitated or being abusive, physically agitated or being abusive, or resisting care. All of these areas were improved for the geriatric client in a nursing home with massage. And a 2013 research study of terminally ill geriatrics in nursing care facilities found that complementary alternative therapies were highly favorable. So you have some genuine positive impacts that you can make in various ways as a licensed massage therapist in a nursing, hospice, or palliative care facility. Please be sure to like our video and join our YouTube station as well as our other social media at CE Institute, whether it be Facebook, Twitter, or Instagram. If you found this valuable, the more people that like our free presentations and social media posts, the more that we'll provide. I hope that you enjoyed this information that we were able to share for licensed massage therapists regarding hospice, palliative, and nursing home care, and tips that can hopefully enhance your treatment in these medical scenarios. If you would like to learn more, please visit our website at ceinstitute.com. We have other geriatric courses and information available. And until we see you in a training, stay safe.